Pop's Daylight Donuts? Man, they've got the best tasting donuts, sausage wraps, pastries in Northeast Oklahoma. And also, if you'll tell the staff there, hey, Scott Townsend said to give me a large spicy pig, they'll give you a free large spicy sausage wrap. But you have to tell them Scott Townsend sent you. So tell them, hey, Scott Townsend told me to tell you to give me a large spicy pig. So there's the offer. There's the call to action. So go to Pop's Daylight Donuts. Say hi to Mark for me. And go to Pop's Daylight Donuts and get you some. The other sponsor is Castafly Outdoor Adventures.
Adventure. That's where it begins. We look to create and document our moments in time while embracing the majestic wonder and beauty of the great outdoors. Our quest is to explore the back roads of the Ozarks, camping, fishing, and just getting lost. Refresh your spirit and join us on our next adventure.
Paul and his crew invite you to subscribe to the Castafly Outdoor Adventures YouTube channel.
Welcome to the Scott Townsend Show, brought to you by Dietzo Man Productions.
Hey, this is Scott Townsend. Thanks for joining the Scott Townsend Show. And today I have with me a special guest, returning guest, Dr. Joshua Gentges. Oh
Hi,
my
Scott.
gosh. Hey, how's it going?
Great.
I had your bio pulled up here and my printer stopped, so it's on my phone now. He's a research director and director of evidence-based practice, associate professor in the Department of Emergency Medicine at Oklahoma University School of Community Medicine. And it's great to have you back.
Nice to see you again, Scott.
So, excuse me. You and I have talked before about COVID, the pandemic, then there was the mask, we talked about the mask and social distancing and washing your hands, why people should do that. Now we're into the vaccine phase that we've all been looking forward to. And people are, there's all now there's new stuff to talk about. Right. And so now there's all kind of things to talk. There's new things to talk about regarding the vaccine. So I have a list of questions here, and I really appreciate you taking the time to visit with us. And there's, like I said, there's a lot of rumors. There's a lot of hearsay. There's a lot of people who don't know. It's amazing how many expert epidemiologists there are all of a sudden everywhere,
Right.
So I hope that people watching this will get answers to questions that they have and maybe help allay some fears out there around these vaccines or vaccinations. So I'll just start asking questions and just, fire away.
Great.
Can I choose which COVID-19 vaccine I get?
It's kind of difficult right now to choose the vaccine, kind of based on, depending on where you want to go. You can call around and try to find places that have a particular vaccine that you like. But the message from the CDC right now is that the best vaccine for anybody is whichever one they can get first.
Okay. And so I guess I can say it. I got the Moderna one. And then the first one was actually, it just felt like someone kind of punched me in the arm the next day. But other than that, and
didn't have any other
No.
side effects.
No.
Side effects are fairly common with both the Moderna and the Pfizer vaccines, and to a lesser extent, the Johnson & Johnson vaccine. But they're not, in general, they're not in general severe. Most people have mild side effects, a sore arm.
Yeah.
I guess I got the Pfizer vaccine and I felt under the weather for 12 hours, both times on both shots. But,
okay.
But, the vaccine itself is, you can't get COVID or anything like that from taking it.
So that leads me to my next question. You kind of answered it, is what are the most common side effects after the first or even the second shot?
So most common is muscle pain at the injection site. Some people, and there's some indication this may be associated with prior COVID infection, but we're not certain about this. will have more severe side effects after they get either their first or second vaccination. Things like headache, body aches, chills. Headache is fairly common. Some people will get a fever. In general, the side effects should not last longer than 24 hours. And if they do, then you should go, either at least call your doctor and probably go see your doctor in that case.
So can you explain when you said they inject a piece of information?
Mm-hmm.
I'm afraid somebody might hear that and think they're shooting a microchip in my arm or something.
Right.
What does that mean? A piece of information?
So more technically, it's a type of RNA, which means it's just like a type of molecule that every animal and plant and creature in the whole world uses to take that information and then transcribe it into a protein. And in those mRNA vaccines, mRNA just stands for memory RNA. Your body will take a piece of your own genetic code, do some things to transcribe it, and then eventually create memory RNA that then is turned into whatever protein it is that your body wants to make. In this case, we start with the mRNA, and mRNA breaks down in your system whenever it's made. Yeah, it's not a microchip or anything like that. It's just a little piece of the protein that the COVID virus uses to get into your cells. And then COVID virus can't get into your cells without that little piece of protein. So once your body has decided that it knows how to fight that, when it sees that protein, anytime it sees that protein, it will have an immediate immune response to it and a robust immune response to it, which for example, with the Pfizer vaccination, 95% of the time it prevents you from getting any kind of infection with COVID at all. And it has almost 100% efficacy in preventing you from getting either moderate or severe symptomatic COVID.
Okay. So do you think I still need to wear a mask and socially distance after I get my second vaccination, which is coming up next week?
I think that people can start to back down from some of the restrictions that the CDC has been recommending as we become more vaccinated. So, for example, if you're vaccinated and it's been 2 weeks since your second shot, it's okay for you to congregate with other people. You can congregate in settings like immediate family or slightly extended family settings. In some cases, it's better if you're in the public to still wear your mask and socially distance until we get to either baseline levels that are very low, where contact tracing and tracking can help contain different outbreaks. But since the vaccines aren't perfect, if you're a high-risk individual, I would certainly still recommend that people mask and social distance in those categories. And the CDC still says that you should mask and social distance really until they take off that recommendation. And part of that is because they just want to keep everybody safe as much as possible. And the other reason that I will continue to mask and social distance is that I think it's good modeling for other people. It's good to give other people the example that this is still the best practice.
Okay. If I've already had COVID-19, do I still need to get the shots?
Yes. The current recommendation, I believe, is that you should wait 90 days after active COVID infection to receive the vaccination. But there's pretty good data that shows that you will have better protection against COVID. And then there are a few new variants of the virus now that it's easier for the virus to get into your cells, has higher infectivity, like you can give it to other people more easily. And for those reasons, it's best to go ahead and get the vaccination, even if you've already had COVID, sometime in the last year.
My next question was, how does the vaccine work? But you kind of answered that already. They're introducing the protein, so to speak.
Yep.
And then
you're teaching your body to make the protein that the virus uses to get into your cells. And your body will recognize that protein as being something that is foreign to it. And then it will alert your immune system to that. And your immune system will then, anytime it sees that protein, be able to fight it.
Is there some concerns about, are you concerned with the EUA, the emergency use authorization that the FDA gave the vaccines, but they haven't been wholly approved by the FDA? Is that a concern? Not at this point. Or has
I
it?
think at this point it isn't. I think that certainly some trepidation with the vaccines was there even among some public health figures when we rolled it out, just because like you said, we hadn't gone through stage 3, all the stage 3 trials, and we didn't really have post-marketing data, and we were rolling it out on a large basis. But in the United States, we have close, over now 100 million shots in arms, right? I think it's close to 200 million shots in arms on this vaccine. And the number of adverse side effects have been very, very low for any vaccination like this. To me, this is an absolute, nearly unqualified success and a public health triumph, getting this vaccine out that fast, and then how safe it has been for the populace.
And the key, the thing I keyed on in there is how fast they did it. That's amazing. Typically, it takes years to get a vaccine approved, and warp speed, it was done in 9 months, 10 months, whatever.
They've got big data now, and they've got better ways to sequence genes of viruses, and they just can, it's almost miraculous, the kind of things that these virologists can do these days.
And then when you've got people all over the world all working on the same problem, you know what I mean? And the way we can communicate so quickly with each other, it's amazing.
Yep. It turns out whenever we all work together toward a particular goal, humans can really do great things.
That's awesome. What's up with Johnson & Johnson? I'm hearing some stuff about they're wanting to pump the brakes on Johnson & Johnson.
That's a good question. And in fact, they have pumped the brakes on Johnson & Johnson. There were some reports of some unusual types of blood clots in patients that received the Johnson & Johnson vaccine. Now, it was less than 1 out of every 1,000,000 patients that received the vaccine. So it's still unclear whether or not the vaccine was actually the culprit. But out of an abundance of caution, the CDC and FDA, they all decided to go ahead and halt continued use of the Johnson & Johnson vaccine. They are going to make a decision on Friday whether or not they think that they can go ahead and restart use of the Johnson & Johnson vaccine. In the US, of the 3 vaccines that have been used in the US, it's the one that has been used the least. Somewhere around 7.5 million people have received the J&J vaccine. But like I said, I think it was 6 cases out of all of those folks. So I think the take-home point there would be that if the J&J vaccine, if they decide on Friday that they're gonna restart use of it, I would consider it safe. I would take it in that case, because I think the CDC is definitely now following all the science and avoiding politicization of what they're doing, and working in a very careful and very thorough way. So I think that it will be fine to take it. And like I said, those blood clots, they may not have been from the vaccine, because the number of clots that were seen in that patient population wasn't very far off what the background rate is.
How many of us have to be vaccinated, this herd immunity? What percentage before we can, where are we at right now, and where do we need to get to? I know we won't get 100%, but what?
So in Oklahoma, and then also pretty much for the entire country, roughly a quarter to a third of people, depending on where you live, have been fully vaccinated, have had both shots. If they have the Moderna or the Pfizer vaccine, the Johnson & Johnson vaccine is just 1 shot. But the answer, there's not a great answer, because no one 100% knows exactly the number we need to get to reach herd immunity. It kind of depends crucially on which variants of COVID-19 we see in the United States going forward. Some of the variants that we're seeing out of South America and out of South Africa and out of England, they are more transmissible. So if it's easier for the virus to get in between, to transfer itself between people, then you have to have more people who are covered by vaccination or by having prior infection. We were saying at the beginning of the pandemic that you would need about 2/3 of the populace vaccinated, but the virus seems to be able to transmit itself more efficiently than what we thought at first. And now we're probably looking at more like somewhere between 80 and 90% of the population needs to be vaccinated before we can reach herd immunity and have it, basically stamped out. And one of the ways we'll know is just as we follow the numbers, as we follow the caseloads down and down and down, eventually they will get far enough down that you will be able to see that there's not going to be any more surges. We are in the middle of another surge right now. Some of the relaxation of social distancing and masking guidelines has led us to another, albeit smaller, surge, and hopefully fewer deaths in this surge, since most of our really vulnerable populations have been vaccinated.
I think I know what herd immunity is all about. I think I understand it, but can you explain the concept behind herd immunity?
I can. So each person who gets COVID will transmit it on average, to somewhere between 6 and 8 people. So for herd immunity to work, you need each generation that the virus reproduces for it to infect less than one person for each person that gets infected. So if I'm infected and I would normally transmit it to 7 people, for example, I need more than 6 on average of those people to be immunized. So for that number, you would say herd immunity for that is about 85%, somewhere around there. So what happens then is the virus, it can't grow. It can't spread to larger numbers of people, because most of the time when it tries to infect someone else, they're already immune. And that's what herd immunity means. It means that most people are immune. And so an outbreak or an epidemic or a pandemic never can get going. So that's how that works.
I was going to ask about hydroxychloroquine and azithromycin or doxycycline. I mean, are people taking that prescription versus the vaccine, or is that recommended, or what?
If they are trying to use medicines like hydroxychloroquine or normal antibiotics like doxycycline or azithromycin, I've seen talk of people using ivermectin, which is an anti-parasite drug. None of those have been shown to be effective at all. So if if someone wants to say, well, I don't need to take the COVID vaccination because I'm on hydroxychloroquine, that's not based on the evidence, and it's not going to work. It does not protect you from COVID. What protects you from COVID is getting vaccinated against COVID.
So Dr. Gentges, thanks for your time and for answering some of these troubling questions, or not troubling, but the rumors, and helping us, or at least helping me calm down a little bit where it comes to the vaccines. I'm in between the 1 and 2, and I heard all these things about 2, the second vaccine, and to be honest with you, I kind of got a little nervous, a little excited. And I really appreciate you talking me off the ledge there. I'm on for the second one. So appreciate you helping me get through that. And everybody who's listening or watching, I'm sure that you've answered a lot of questions that they have. And, where can a person go to get more information if after they've heard this, watched it, and they have more questions? Where would they go?
Like if they've decided that they want the vaccine, or if they just have general questions about it.
Well, like what's in the vaccine, or
right.
what, just anything.
So the CDC has a good area on their website that talks about the vaccine. And if they want more local information, I would go to the Oklahoma State Department of Health. They can give information about what's in the vaccines, where people can go to get one, what they should expect whenever they get one, and all of those things will be aligned with what I've been saying today, because I try to make sure that I follow the evidence and kind of stay within the wheelhouse of public health on these things.
Right.
The take-home message is, people, go get your shot.
Go get your shot. All right. You heard it from Dr. Gentges. Go get your shot. I'm going to go get mine. So well, I appreciate your time. Thanks for lending your expertise. And it's always good to have you on the show. And you're welcome back anytime.
It was real good talking to you again, Scott.
So for Dr. Gentges, this is Scott Townsend. Thanks for joining the Scott Townsend Show. Have a great day, and we'll talk to you later.
The Scott Townsend Show is a Dietzo Man production. For more episodes, visit the Scott Townsend Show YouTube channel, listen on Apple Podcasts, or wherever you listen to your favorite shows.